Okay, today we're going to learn how to do an extremity prep using betadine solution and betadine scrub. Now, we're going to pretend that this prep is for a fractured finger on her left arm. So, that being the case, we're going to look at our preference card, and we're going to find that on our preference card, our doctor wants betadine scrub and solution. Now, betadine scrub will come either in your kit or it's going to come in a jug that you'll have to dilute. And we typically dilute betadine scrub with equal parts of sterile water, or we could use sterile saline too, it wouldn't matter. Some kits come with betadine scrub already pre-diluted in them, and so it just depends on where your hospital purchased your kit from. We could, of course, make our own kits, so we could get some sterile bowls or potty, and we could put some sponges in and sterilize them, and we could make our own kits. So today we're going to be using the betadine scrub in solution prep, meaning that we're going to scrub, because this is a fracture, we're going to scrub for 5 minutes. Then we're going to towel the scrub off, and then we're going to follow it with a paint that we call betadine solution. And so because we're going to pretend she has a fractured finger, we'll pretend her middle finger is fractured. So we're going to prep from her finger to her wrist, and we know that our patient would be asleep for this type of procedure. So what we would do is we would have to prop up her arm and make sure that it's held up so that it doesn't get contaminated during the prep. So we're going to start with just putting down a tripod or chucks to catch the drips. And then for this I'm going to have to make sure that she's pulled over to the side of the bed more. And I think what we'll do for this is we'll just have her hold her arm up for us. But know that if she was asleep, we would have to prop it up so that it would stay suspended. And we're going to prep from the fingers to right before the elbow. So the first thing that I'm going to do is I'm going to get the kit ready. So I'm going to take the dust cover off, and I'm going to place it on my prep table, making sure that my prep table is dry. And I would have checked for sterility by checking expiration date. I would check for any holes or tears, water, dirt. I like to put this kit on here at an angle so that when I open it up, that it covers the whole table. So I'm going to always open away as an unsterile person. I'm going to open my flap. I'm going to open this flap, and then I'm going to open the last flap. And because this is too close to my sterile edge, I would never touch here. I'm going to just pinch this back here and open it up. And you can see then that the kit covers the table. Had I opened it up the regular way, we would have had metal exposed on the table, and it would have decreased the surface for me to put my prep supplies on. Now, this is only one way prep kits come, and this kit is going to come with a set of sterile gloves, 2 towels, and this particular kit comes with 3 sticks and 6 sponges. It also comes with betadine solution, which is your paint, and it comes with betadine scrub. This particular brand has diluted. If we had used the scrub that wasn't, we would have to add water to it. So this is how my kit is going to come. So that being the case, I have a couple of options here. I can pinch this towel, my gloves, and I can try to grab the towel at the same time and lay it on my field, but that's going to be nearly impossible. So I'm going to pinch the gloves and take the gloves off the field. Now, I have some options here. My options are to put one glove on and finish opening the kit and pour my sterile water using my non-sterile hand. And I'll show you how we're going to do that. And then next I'm going to show you if the kit had come with a tissue forceps. And this is a real metal one, but sometimes the kits come with a plastic tissue forceps that's on here. Now if that were the case, I would have to grab the tissue forceps, and by doing so I have now contaminated this glove package here. So what I cannot do is grab my gloves by touching where I touched with my hands. So what I would have needed to do is take the tissue forceps off and grab my gloves and towel away from where it was contaminated. Put this in my hand. Now the tips of my tissue forceps are still sterile, so I can remove this, and I want to think about where I'm going to prep. I'm going to be prepping over here, so I do not want to put this here, so I am reaching over my towel with wet liquid. So I'm going to choose to put my towel over here without reaching over this. You see, I'm just grabbing the edge. And now I can choose to turn my kit with my tissue forceps. Now I don't need my tissue forceps any longer. I can put on my gloves, take my bottles out, and I will have to pour my sterile water first though. Okay, so that's one scenario. We'll go back to the original scenario where the gloves are on top without a tissue forceps. So I remove the gloves. Now what I'm going to do is I'm going to put one glove on, and I can put my gloves anywhere. I'm going to take my towels off. I'm going to come over here because I'm not going to reach over. I'm going to grab my sterile solutions, and I need to pour my water. Well, I only have one hand, so how I'm going to have to do this is open up the bottle like this. I'm going to check the expiration date, and my scrub is going to go in this side, so I'm just going to put the lip of the bottle over. I can come like this. What I can't do is come like this. So you're just going to keep the lip of the bottle over. And you're going to eyeball the amount. Now my bottles were sterile, so they were in the kit, so now I can put my second glove on. So I'm going to pick up my second glove using the open glove technique. And now I'm going to look for my betadine scrub. So I'm going to pour scrub in this side. And I'm going to pour solution in this side. Okay. Now we're going to ask our patient to bend at the elbow. And could you hold your hand up? I'm going to be washing your hand with some orange colored solution. We call it betadine. It doesn't hurt. It's going to be a little cool though. And we're going to scrub for 5 minutes. So I'm going to get my sponges kind of wet. And I'm going to start at the incision site, which we know is her finger. Now if this were fractured, I'd have to be really, really careful. Now we're going to be scrubbing for 5 minutes total with 6 sponges. So you just need to look at the clock, and we really won't do it for 5 minutes today. But you want to make sure that you get all her fingers good, in between the fingers, the web of the fingers. And if your patient's awake, they certainly can help you with this. You can say, could you spread your fingers, please? And we're just going to do little circles here. What we never want to do is drag dirty to clean, so we would never do big strokes. We're going to slowly work our way down. And the one thing about this betadine scrub is that, as I said, normally we have to add water. This one really comes a little pre-diluted, so I didn't need to add very much water to this. Now we cannot touch this, and we don't want to set our sponges down and put our finger down because we'll contaminate our gloves then. So what we would do when we got to the end was we would throw these in a kick bucket, or we would throw them in another garbage receptacle. And we're going to go to sponge number 2. And remember, this is going to be for 5 minutes. So we'll start again at the incision site. Now, let's just say that this was a different procedure. Let's say this was a carpal tunnel procedure. Then I would have started where our incision would be on the wrist, and I would scrub in this area, and I would take my first set of sponges and I would work my way up. I would get rid of them. I would get my second set of sponges and I would start again at the incision site, and I would work my way down and I would get rid of them. And then I would grab my third set, and I like to go down with one sponge then, and then go up with the other. So that's how I would do a carpal tunnel. Would be then just a little bit different than doing fractured finger. So with the fractured finger, we did all the fingers then, we did the palm and the back of the hand, and I'm going to work my way down. And remember, this whole process should take 5 minutes. And I'm going to get rid of my second set of sponges, and I'm going to go to my last set. And this whole process is going to take, again, 5 minutes. Now, we're done with the scrub. And if we have sticks, then we only need to put one pair of gloves on. So our next step is that we need to towel dry the dirty, sudsy debris off. And so we're going to take our towel and we're going to open it up, keeping it sterile. I guess I have 2 of them here. And I like to kind of put it together, to come over here, and I'm going to try to figure out the best way to put this on her. And I know that part of it is going to get contaminated. And so we know that it's contaminated down here, and the rest of it looks pretty good. So I'm going to take her hand, and I'm going to slowly squeeze the prepped area off. Now, because this is contaminated down here, I need to take this towel off without contaminating where I've prepped. So I like to say that you need to peel it away. Don't lift it, peel it. So I'm going to grab where it was still sterile, and I'm going to peel it back and peel it off this way. What I did not want to do was, because this was contaminated, I did not want to do this, because that tip would have contaminated her prepped area. So I'm going to once again just kind of take it and peel it off. Now let's just say I needed more. I didn't get the prepped area off well. I could take my second towel, and maybe you don't even need to open this all the way now. Let's just say I didn't get her hand very well. I could just do this, and that would work fine. Now we're going to use our sticks. And our sticks are a paint. It's just betadine solution. Now I want to back up and talk about, had we not had sticks. Let's just say we had sponges again. Then you need to double glove. And now would be the time that I would have taken my outer gloves off, and then I have a second pair of gloves. Because we don't want to use the same gloves that we prepped with the scrub on new sponges. But because I have sticks, I don't have to worry about that. So what I'm going to do is turn my kit, and I'm going to grab this stick, and I would get it in my solution, and I'm going to start your finger, and you can see that betadine solution is much darker. And however you need to go around the fingers, if your patient's awake, you can say, can you spread your fingers? Some people twist it around, some people dab. However you get the betadine in there. Now you want to look to make sure you haven't missed anything. And if you have, you're going to catch it with the next sponge. I like to go around the extremity like this. Now, if for any reason you needed to hold her hand, you would have then needed a second pair of gloves so that you could have touched her hand now without the gloves that you used to scrub. So that's number one. And our last sponge, we just do the same thing. And it's okay if it drips down. You do want to be careful too sometimes. If your patient's awake, sometimes actually we'll pull the towel or a blanket up so it doesn't splash in their face. You wouldn't want this to splash in their face.
And if it was a carpal tunnel, how would you do the 3 with the sticks?
Okay. And we'll pretend that I didn't miss anything. If it was a carpal, I would have started at the incision with my first stick, and I would have gone around and then done the back of the hand, and I would have come up and finished the fingers. I would have gotten rid of the sponge. My second one, I would have done the hand again and around the side, and then I would have gone back down with my second sponge, and then my third, kind of just do the incision area here. So that would be how I would do it.
Now, does the solution have to be 5 minutes like the scrub?
No, the scrub is the only part that's the 5 minutes. So I think the big thing is that the kits can come a number of ways, and you have to figure out how to open them up sterilely. And so if they come with a tissue forceps, that changes how you open your kit than if they come without one. If they come with solutions, sometimes they come with the little bottles in them, sometimes they don't. Sometimes you'll have to use the gallon jug. And so that changes things, because when the bottles are in the kit, the bottle, the outside of the bottle and everything is sterile. When the bottle is down here, it's not, so it changes how you set up your kit. So a couple things that you want to think about is, if I were going to use this towel to dry her, I would never wanted to have taken sponges that were wet and put them down here, because wicking action, it would have soaked up the solution and we'd have strike through. So you got to think about that. You have to think about where you want your kit. Do you want it this way? Do you want it this way? Do you want it this way? You have to set it up so you're not reaching over it ever. You have to pour from the sides. I really think that if you learn this skill really well, and even though that most of the time the RNs will be doing the prepping and surgery, but you as a surg tech will have the opportunity to maybe help them out. There are some hospitals that you may do some of the prepping. For instance, at St. Luke's in the cystology room, the GU department, the surg techs prep. So you do need to learn how to do prepping. But you may have on occasion the opportunity to help with a prep. Maybe the arm is unstable, so the RN might ask you to put on sterile gloves. You would not touch until they had prepped an area, and then once they'd prepped, you could hold the hand and maybe hold the arm, your hands are cold, up for them or whatever. So that's kind of a basic prep, a betadine scrub followed by solution, so it's 5 minutes. If this were a total joint, we would have done the scrub for 10 minutes or a heart for 10. But we're seeing more where they're using DuraPrep for hearts now in the chest. So, any questions? Do you guys have any questions?
What about if it came with the ones without the sticks, and you knew you had a double glove?
Would there be 2 gloves in there?
No, then you're probably going to have to go and get a second set of gloves, and then you would put 2 pair on, and you would scrub, you would dry with the towel, and then you would take the outer gloves off. And it's the same concept as glove to glove, skin to skin, only it's glove to glove again, and you reach under, so you do the same concept. And then you would, after you dried, then you would take the sponges with the paint, and you would do the painting. So, yeah.
So, now, normally if there were a solution dripping on the table, it would be declared unsterile, as long as it's not wicking close to something and the little drips.
Right. I'm not going to use this anymore. So I could have put it back in the other side, or I could lay it there if I wanted, as long as my sterile towel that I was going to use wasn't anywhere near it, and so it didn't wick. It's a good idea to have a garbage can or a kick bucket or something to throw your sponges in. So, any other questions? Okay, good. Your hand's cold. You